I urge people when we have this discussion
Yeah.
not to think of health reform as being a political event that occurred on a particular date, not to think of it as actually what happened in 4 years. Health reform is something that is scaling over the course of 40 years. And the truth is we are about 25 years into a 40-year transformative period in healthcare, driven by all of the facts that were laid out by the introducer earlier. I think if you look at this as to how we got here, I think you have to look back to the 1960s when we started Medicare and Medicaid, and it was a great expression of our country's sense of compassion. We want to live in a place where people are cared for when they're sick and when they're injured, and we established a plan to accomplish that. But in doing so, we laid out some policies that turned out to create incentives that were unaligned, that began to fuel spending at a rate we just hadn't contemplated. And in the early mid to 1980s, we began to try to change that from a process we now refer to, and you've all experienced this in the hospital world. If you have a procedure, there's a billing for that one procedure. And over again, you'll have 200 procedures if you just go into the hospital. And that has just inspired only one thing, and that is everybody has an incentive for more. If you're a provider, you get paid by doing more. If you're a physician, you get paid, or rather, if you are a patient, you want to have more, and you've got a third party paying for it. There's no connection between these two. And so we now find ourselves in this very difficult position where for 30 or 40 years, prices have been escalating at an unsustainable rate. And we're trying to figure out how is it that we sustain this human value of compassion. And we're confronted now by another force, and that is the potential that our economic leadership could be challenged. Yeah. So you've got this collision between these two important values, our sense of compassion and our economic leadership. And when it comes right down to it, if you want to look at the political debate around healthcare, that's what it's about. It's about that collision, and you might go one other layer, and that is, what is the role of government in our lives? Do we want government to control that? And but we're now at a place where it is beginning to have. No one would know this better than the people in this room, but there's no place on the economic leaderboard for a country that spends 25% of its gross domestic product on healthcare. We're not quite there yet, but we're competing with countries who are spending a third of that. This is not about healthcare. This is about the economic equation of America. Or to say, what does the healthcare system look like in the future, I would say this, that we're going to see more and more integration between insurance plans and and healthcare providers. And that gets to some of the administrative component. There's all this billing that goes on. If you could begin to move toward what the industry refers to as value-based care, where you're actually paying for the value that is received by patients. If you're paying for what has actually worked, if you're paying for the amount of improvement that's been made, then you get rewarded. Well, to do that, you've got to begin to have more integration. And when I say use the word integration, what I'm actually referring to is less redundance. And more and payment being done on a basis other than just a piecemeal basis where everyone is rewarded for more.